Good morning. My name is Dr. D.K. Sriram. I'm a senior consultant diabetologist at Apollo Hospital, Greams Road, Chennai. When we talk about diabetes, we talk about control of blood sugar and reduction of complications. We give patients medication to control blood sugar, be it tablets or insulin, and also treat the other factors that contribute to raise blood sugar. But today's talk is about two factors. The first is stress, and the second is insomnia or lack of sleep. Let us start with stress. Stress has become a day-to-day occurrence in our busy life schedule. Quite often, we do not focus on how much stress contributes to lack of control of blood sugar. It is very important that when we see a patient, we address stress as a factor in controlling or raised blood sugars. We see this in the outpatient setup. We also see it in the inpatient setup. In the outpatient setup, because of a busy lifestyle, because of factors that contribute significantly to stress, be it acute or chronic stress, there is a lack of control of blood sugar. Addressing stress by communicating with the patient, whether the patient is under a great deal of stress, and factors that we can use to control stress. The factors that we can use are first addressing it, secondly getting a lifestyle and dietary pattern that can contribute to reduction in stress. What are the ways you can reduce stress? First, being aware of the stress. Secondly, a daily exercise pattern. Thirdly, taking a break during a very busy and high stress situation to get a grip on the stress are all important factors in today's control of diabetes. There are various methods of control of a stressful situation. Meditation, yoga, exercise, taking yourself away from this stressful situation are some of the factors that are commonly employed. Now coming to the second bit, that is insomnia. This has gradually become a very important part of how we lead our lives, the lack of good sleep. When you have very high blood sugar, sometimes you have to get up in the middle of the night to pass water, and that can contribute to a lack of a good sleep pattern. The other factors that come into play is for us to carry a lot of stress, go into the night, not have a regular sleep pattern, and a certain diet and lifestyle advice can contribute to lack of a good sleep. The primary thing we should have is a good sleep hygiene and a regular sleep pattern. Though this may not be possible with all of our occupation, we must try to get a good sleep hygiene, a good sleep pattern, have a regular habit that gives rise to good sleep, and also ensure that we have some form of exercise which contributes to it. Even our water intake to dietary intake should be looked at to see if they contribute to good sleep or the lack of it. The other factors is having coffee late in the evening or having any stimulants that contribute to lack of sleep. If we are able to address these factors, then the chance of a good sleep and hence a better control of blood sugar is possible. These two factors, controlling stress well and having a good night's sleep, contributes greatly to control of blood sugars apart from medication in the management of diabetes. So it is imperative that we address these factors in all of our patients to ensure better glucose control and better reduction in complications of diabetes. Thank you.